So, without further ado, drum roll please, I'm going to ask Helen and Stefan to come up and help do a type of peer-to-peer discussion, and then afterwards for you to find a partner and just have a quick peer-to-peer discussion, for 5-10 minutes as well to see how you get on, and we feedback sort of what we've learned from it as well. Yeah, sorry.
That's okay. So just to give you some background, the reason why I've asked Stephen to come and do my peer-to-peer, we don't work together, but I'm an ACP, and Stephen is a legendary ACP who's been very well embedded in his role, and actually I'm just about finding my feet, and this is where I want to see my practice grow and actually looking at my feedback. So it'd be interesting and I always find it invaluable actually having these peer-to-peer discussions. So I'm not shy.
No. I
am. So, hi Stephen, we've met before and I'd like to discuss my peer-to-peer review with you, if that's okay. So at the moment I'm in my final year doing my ACP, but what I'm finding is the clinical stuff is really quite overwhelming. So just wanted to sound out a situation where I was a bit taken back by actually my ACP skill base. So the situation was a patient came in who was discharged out of hospital from A&E, was told everything was okay, came to see me on an acute appointment and presented with a headache, did ABCD assessment and actually realised there's red flags, there's changes in neurological symptoms, so I did a neuro exam, did basic OBS, and actually BP was out. We definitely had changes in neuro function, so I was querying possible TIA and referred on to the GP. And interesting, the paramedic wouldn't take my patient because I was a pharmacist. But I challenged the decision and got the patient admitted, and it turned out the patient did have a TIA and a second degree heart block. And the patient came in a couple of weeks later to say that she was very grateful that I saved her life, but I just found the whole experience quite overwhelming because that could have easily gone the wrong way, and I just wondered.
I guess a good starting point is to think, amongst all of that, you did a lot of good things. It sounds like you stuck to the A to E structure of assessment, which is obviously one of the foundations of how we're taught to assess patients. You had sort of a good intuition of what was going on there, so that all sounds really good. But I guess for me, if there's something you could put your finger on, where do you think it went wrong, it made you feel uncomfortable, where did that kind of come into it?
I think it's the lack of confidence in my own ability, being quite new into ACP, even though I see patients day in, day out, I see about 30 patients a day, but it's just that acute illness setting, whereas I'm really designed to do quite minor things. And technically speaking, it was a headache that she presented with, but it's just hard, you just don't know what you're going to get through the door in general practice.
Yes. Yeah.
I just don't know whether I need to do some more development, or where do I go to for more learning really for those sorts of settings.
So how well are you supported in terms of that sort of thing? Do you still have a GP mentor? Because one thing that I've done is kept my mentor that I actually had.
Okay.
So, I did my training for 3 years, just like you've done, and now 7 years down the line, I've still got the same mentor that, I don't spend every day with her, but she's there for me to kind of have that discussion when I do have a patient like that. And because we've already developed that, sort of mentor-mentee relationship, it's quite a safe space to discuss like a patient, and not kind of have the feeling of, well, maybe I'm completely barking up the wrong tree and I might be a bit embarrassed about this, or that fear that your kind of suspicion might not be taken further.
So I'm quite fortunate that we have a duty doctor that I have access to regardless of clinic, which is great, but it's just, you just needed that in the moment feedback to kind of go, this is what went well, this is how you needed to be more assertive. I've not had that yet, and I think that might be a good idea, taking that forward with actually maybe having some regular feedback sessions with a clinical mentor, so that might be a good thing to kind of raise the confidence and the unknown.
Because I actually find as well, so you know my practice is slightly different. I'm in emergency medicine, and you know, kind of like debrief is something that's quite built into what we do. So anything that's kind of termed an emergency, you would have that option to debrief. But even kind of just the majors patients that maybe aren't resus patients, quite often, maybe a day or two later, I'll kind of just informally discuss the case with one of the consultants that I kind of trust, and I sometimes pick up things there, like, you know, maybe they think, oh, why did, you know, like thinking of an example the other week, they said, oh, why did you put oxygen on that patient when you assessed them? And I was like, well, the mum's a doctor, and she was talking about, you know, tracheal tongue and all this stuff, so I thought, right, I'm going to just, you know, go and big guns here, sort of thing. So I think things like that can certainly be helpful. I mean, I guess one thing that I would sort of challenge is maybe not the right word, but I think coming towards the end of the training, you know, the training's quite defined, isn't it?
Yeah.
And also, you know, the kind of supervision throughout training. It's about making that plan. So I guess it's kind of touching on what I was saying about the mentor, but it's the what next bit that I think, you know, you're obviously at that stage. You need to, you know, when you're doing your PDR or whatever this year, that's something you really need to be thinking about, is how you're going to continue to be supported, and whether that's, you know, buddy in with another ACP, because that can be quite a useful thing to do, or maintaining, you know, that medical kind of supervision.
I think it's great that we have a really good professional relationship, because even though we work in other ends of the country, we understand actually as a pharmacist ACP, the skill base is slightly different, but actually the scope, again, could be anything. So actually it's great if we can just keep in contact and maybe do this, not just an annual thing, but maybe just touch in periodically where I need to. That would be great.
Excellent. Unscripted, man. These guys are pretty